Hello guys, welcome to Pajon Imaging Hub. In today radiographers and other health professionals series, we'll look at 28 days and 10 days rules. Are they still necessary? Please don't forget to like, share and subscribe to this channel so that you'll be notified when new video is released. Thank you. Welcome back. 28 days rule state that in a woman of childbearing age, X-ray procedure involving abdomen and pelvis should be restricted to the first 28 days of the last menstrual period. The rule assumes that if a woman's last menstrual period was within the past 28 days, there is a lower probability of pregnancy. Until the period is missed, you cannot be too certain of pregnancy. But if a woman's last menstrual period is longer than 28 days, that means she has missed his period, or close to missing her period, then she is considered potentially pregnant until proven otherwise. Then such X-ray procedure involving abdomen and pelvis and high dose procedures should be postponed so that we don't irradiate the fetus that may have formed. That is 28 days rule. Then 10 days rule states that X-ray procedures of lower abdomen and pelvis and those involving high dose should be performed within 10 days of the start of the woman's menstrual period. It is expected that pregnancy have not occurred at this period. Now, a conservative approach used by some radiology facilities is to apply a 10-day rule only for examination with the potential to deliver a high dose to the lower abdomen and pelvis, such as barium enema and CT of the abdomen or pelvis. Then uses 28 days rule for all other examination. Because within the 10 days rule following the woman's menstrual period, the chance of the woman being pregnant is very, very minimal. It's very, very insignificant compared to that of 28 days rule. So there is some department they have to adopt this method that when the a radiation text involve a high dose, then they use a 10 days rule to book the patient. But when it is other examinations that are lesser dose, then they can use the 28 days rule to book the patient. Then any other thing closer to the patient's menstrual period, then you have to book the patient to allow for the menstrual flow or non-menstrual flow to check whether there is pregnancy or there is no pregnancy. If there is no menstrual flow, then beyond 28 days rule, then we have to rule out pregnancy before such investigation can be done. Then the rules now, are they still necessary in radiology practice? Well, methods of testing for pregnancy or ruling out pregnancy are easier and prompt these days, so they may not be necessary to apply such rule because now you can easily test for pregnancy. But where test for pregnancy for whatever reason is still not available at the time necessary, then the rule should be applied because we don't want to irradiate a child, a fetus in the womb. When pregnancy has occurred and there is justified need for X-ray, necessary precautions in line with international and national conventions and rules should be applied. And what are these rules or conventions? The exposure should be made only to the area of interest. So adequate collimation should be applied. Then shielding should be applied. Then lower possible factors should be used. Then use of digital. If places where they have digital and manual, they should use digital because it gives more assured image than manual. Then if it's manual, then they should use a fast screen cassette to do the exposure, depending on the situation. Then reduction of exposures. Most cases you try to do AP, you try to do lateral. In some cases, if only one view is enough to get what you're looking or make your diagnosis, there is no need of trying to complete the lateral. An adequate communication with patient will help. That will help to ensure their cooperation. And when they cooperate with you, then the chance of repeating their exam is minimal because they'll be able to obey what you say. All this should be applied. Thank you. Like, share, and subscribe to this channel. Bye for now.